So I'm gonna demonstrate how to conduct like a routine vaccination. So I've done this before in one of my other units. So I'm gonna scooch this way a little bit. And an intramuscular, that's a mouthful, injection is, you could either do it in this big neck muscle here, or on their bootay. But I prefer the neck. It's probably a little bit safer, to be honest. But say you have your needle, you got all your liquid. This is quite big. My buddy, I'm not gonna give you a real one, okay? You could pinch the skin and insert it just right under there, very gently, and just slowly inject the stuff or whatever you're giving the horse, and then pull it out straight. Do not twist it. And then once you pull it out, you give it a good rub to get the blood flowing, and massage it into the muscle. Yeah. And then to do, I don't actually know what it's called, but an injection into the veins or the blood, whatever you want to call it. It's a bit trickier. I've never done it. I don't know a lot about it, but I've seen it done and I've helped with it done. So generally you would hold the horse's head up high. This is all what I've been told or taught. And you'd find, I don't know how they find it, honestly. Like the vein that runs somewhere along here. And you would have your needle and you'd insert it. And then to check if you hit the vein, you pull slightly back on the thing, and if it won't pull straight out because of the suction in here. But if you see, blood rush in, then you've hit the money. But if not, then you kind of have to keep jiggling at it. And I know my old boss and I, we spent longer than I'd like to admit trying to find it, and this horse just couldn't find it. So, and we tried both sides as well. Some horses are better on either side. But yeah, vaccinations. Bam. What? Do you have an itch? Do you have an itch? Okay, come here. Lift your head up. Lift your head up. Come on now. You can do it. Be a star. So I don't have the equipment here to drench a horse, and none of these horses need drenching at the moment. I like to think of drenching as just giving them Gatorade, a bunch of electrolytes and stuff like that, isn't that right? So generally I see it as a possibly 3-person job. The first person would be, inserting the tube into the nostril, which goes all the way down my throat. Thank you. And then another person could be, pumping the stuff into the tube. And then the third one, which is usually me, could hold the horse. And while this is being done, they usually have a restraint, e.g. a nose twitch. Come here, I need to demonstrate. Let me put you in my pocket. I need to demonstrate. Yep. He's a bit of a goofball, which is just like a little piece of twine and whatnot that just grabs around there and you twist it. There's also metal ones, which are just kind of clamps. And then what I've seen done is they twist back and you just kind of tie it to the halter so you don't constantly have to hold it. But yeah, drenching, I think it's pretty simple. Buddy. I think it's pretty simple to explain. But yeah, really it just gives them, some extra vitamins or electrolytes that they may not have. Do you mind? You're not being very compliant. Anyways, I should have brought some treats with me, shouldn't I? But yeah. Still fun. Hey, I'll paw with you, buddy. To conduct a routine skin washing, I haven't ever washed him. But my instructor's horse, I've given his back what I would call a skin washing. You can obviously, use shampoo or horse gloss to give them a wash, but skin washing is more medical. And I don't have anything with me right now. Hey, but something that is good. It's like a tea tree kind of scrub. Sorry. Play with this towel. Okay, I'll put a towel on his face so we can play with it. Yeah, it's like a tea tree kind of shampoo sort of thing. That you can just you just scrub in there, and I think it's pretty good for rain rot or just kind of any like fungus that they have anywhere. But generally, my instructor's horse had it all over his back, which has gotten pretty better, much better since we started washing his skin. So yeah, he's loving this towel. Baby horses, right? Okay, and to apply a dressing, or I believe it's pronounced poultice. Sorry if I'm not quite right. But I don't actually have one with me because it'll be a bit of a waste of materials, if you didn't actually have one. So I'm gonna pretend this is one. I do not remember the exact definition of what it is. I'll put it on the screen now. But what I can remember and what I've seen, it's kind of like a warm cloth, and when you put it like over an abscess, it just like draws out all the gunk. Sir. But yeah, so I'm gonna just demonstrate. Stop. He's gonna bite me. Trying to get him to pick up his little footsies. Stop. It's not too keen, hey? But yeah, you take the poultice and you kind of put it over there, and then generally you'd wrap it up in vet wrap very, very snugly, and then go over it again with duct tape, so it doesn't come off. But yeah, so this is usually like a warm rag, it's not a rag, it's more like cotton, and it would just draw out any gunk in the abscess if he had one. You good? And also, once you wrap it, it's always good to cut like a V shape on the front of the hoof to like release any pressure that's on the cornet band, to make the horse as comfortable as possible. And when like applying a dressing, say the horse, it had a cut there, or one of our horses has a cut on his back leg. He got tangled up in a gate. Quite smart, if you ask me. But you kind of take, it's kind of similar to this. It's just like fluffier, and you put that underneath. I don't remember what they're called. It's kind of just like a padding, and then you wrap it up with usually just a bandage. And then you can take it off after like a few days and wash it, and then inspect it again, and then put any more medication on it and such and stuff like that. Yeah.